This is my client's second visit, and yesterday she presented with a step down of the right pubic bone, and they still are symmetrical today after yesterday's treatment, and I can slide straight across. I no longer climb up when I do that. And the other thing is that when I do a superior spring, I can take up the slack. I see her head move, so the force translates through that joint. And then I can spring it and I see her head bob each time. So we've restored movement in that direction. You'll recall also that this motion was blocked and this motion is present today. So the treatment that we did yesterday worked. And I will have her self-treat to keep that motion, and I'll film that in a little while. Now what's interesting is that when she bends her knees and her feet are together, okay, there is a subtle asymmetry. That's not subtle. I'm dropping my head down and looking at the top of the tibia. Can you see that you're taller on this side? Mm-hmm. Okay, and you're also longer on this right femur, okay? And so you have some developmental asymmetry. But when you put your legs out straight, we don't see that. I'm looking at your heels and your medial and lateral malleoli, and they look even. In this position, I see your right patella is lower, okay? And I also see that the ASIS is still forward and it's still lower on the right side. However, you have restored motion. And I just tested you a while ago in multiple directions, and you have good motion in all directions. So this is the part of the asymmetry that you get to keep, okay? So it appears that maybe you have developmental asymmetry of the pelvis, but you compensate in the legs somehow. Because when you stand, it looks very symmetrical, and when you sit, it looks very symmetrical. Sometimes I'll have people sit on a 1/4 inch craft foam under one sit bone to restore their normal posture, because the chair tries to force an uneven pelvis that's developed that way into a false symmetry, and it causes postural discomfort. But you don't need that. Again, we looked at you in sitting and it balances out. So let's have you lie on your stomach, please. So yesterday we had blocked inferior glide on the right side. I hope my other camera views were good. I apologize if they weren't. So yesterday we had blocked motion going inferiorly on this side, and that was with the right anterior ilium. We had blocked motion going superiorly on the left, and that is now resolved. Okay, I was unable to rotate the left ilium forward, and that is now resolved. Okay, and we had blocked inferior glide of her sacrum, and now I can take up the slack and I can spring that, and now I can put the heel of my hand above the tailbone on about sacral segment 4 and 5. I can take up the slack and I can spring it, and that moves well. And then the same thing for the L5. Had blocked motion yesterday, but now I can take up the slack and spring it very gently. I spoke of how patterns change, and there is now a restriction in the transverse plane. I'm on the right PSIS, and I'm springing at about a 45-degree angle, and you can see that I can move it and take up the slack, and I can spring it, and there's motion. On this side, when I try and go the opposite direction, it doesn't move. And this is what I call a type 1 right inflare, left outflare, but honestly, I think it's just the whole pelvis is twisted to the left. And you still have some soreness in here on the left side today. And the ligament I can't tell the difference. I can't tell the difference today. Yesterday I could, today I can't. So anyway, let me first show the self-treatment that I'll have you do for the right ilium. So lie on your back, please. So once a day, forever, you're going to hug your right knee to the outside of your right shoulder. So it's pointed out about 20 degrees. And you're going to just hug that for 2 minutes. Okay? And that will keep that anterior ilium corrected. So go ahead and step down. You can sit on that black stool. And then I'm going to demonstrate the self-treatment for the left side. Can you be my cameraman?
Absolutely.
So you can go sideways and you can go up and down, and on the top you can zoom in and out. But I think we have it at the right angle. So once a day for a week, I want you to sit on the side of your bed and then lay down. So both feet come up, and then you move your feet over to the right, and then your pelvis is naturally going to come over a little bit, and that's fine. You're going to drop your left knee, but you're going to keep the thigh inward like this, and that will stretch all the soft tissues on the left anterior portion of the pelvis and hip, and it captures the approximate plane of the SI joint and theoretically rotates the ilium forward. But another model is that it moves the whole pelvis and restores symmetry of position and mobility in the transverse plane. So this is the self-treatment, and you only need to do that for 1 week. Okay? And now let's have you lie on your stomach. Thank you. So to treat the transverse plane, we're going to take this 2x4 by 8 inch foam and put it under the right ilium like that for 2 minutes. And then I'll have you lay on your back. And then we place it at about a 30-degree angle under the left hemipelvis. So we're capturing the ischium and the ilium. I'll show you that on the skeletal model. So we want to be under the ischium here, and we want to be under the ilium there, but not on the sacrum. And so you take the foam and you just capture this oblique angle, about a 20 to 30 degree angle, and you just lay on that for 2 minutes. Okay? So I will have you do this once a day for 1 week, and that will resolve that pattern. Okay? Let's have you on your stomach again, please. I'll take that out. And then once a week, have Josh feel the bottom of the sacrum. That's the tailbone. Okay? So you just put your hand on the upper 2/3 of the pelvis, and you should be able to bend your middle finger under the tailbone. Okay? Your hand fits beautifully on that sacrum, and what you're going to do is you're just going to push it inferiorly and take up the slack, and then see if you can get her feet to bob. Okay? If that tightness should return, then you simply put 2 pillows under her stomach so that you get lumbar flexion and a pillow under her ankles, and then you simply just contact that and just push inferiorly with about 15 pounds of force, and set a timer for 5 minutes and just stay on that. Okay? So that concludes how I'm treating her mobility pattern of the pelvis, and it was a nice example because an inferior pubic fixation is fairly rare. So I'm glad that we were able to demonstrate that, and I'm glad we were able to demonstrate the sacrum that lacked inferior glide and lacked backward bending, and we also addressed a right anterior ilium, left posterior ilium, and then what's called a flare pattern of the pelvis, the transverse plane motion problem. So one last thing, after treating you yesterday, you noted that you could bend forward and reach without reproducing the pain?
Correct.
And that was like the test, correct? I mean, that was like the best test we could use.
Yes.
Very good. So I hope this video is informative.